I came in here 1999 and just started sweeping the floor, and little by little people would come and help. Oh, I'm a nurse. Okay, volunteer, come and help. We started, two days later we started seeing patients, and we've been open ever since then. So that's now 13 years. And it's well over 1 million patients. We've grown. We started off with just this room, and now 300 patients a day. We've got 50 inpatients. We deliver over 100 babies a month. We go to 7 districts with mobile clinic. We are doing a ton of work.
So at the moment in the hospital we have 2 young women who have really now terminal cancer. One is an osteosarcoma, the other is a chondrosarcoma. And these are lovely young women who in Australia would have had a really good chance of surviving these problems, but it hasn't been possible to manage the problems that they have here. We don't have the testing ability, we don't have the skill and experience and the medications to have treated them at an early stage, and so unfortunately the only thing that we can do now is try and help them to be comfortable.
What are you going to do with your life? You know, it's really hard. Okay, I can say I'm going to try to contribute to reducing human suffering. Somebody might say, well, that's pretty small in the overall point of the world, but you know, if you start trying to think about the universe, and well, you're going to end up mentally ill probably. I'm just going to keep it simple. Somebody's suffering, and I think I can do something to alleviate that, or to at least hold it down a little bit. I'm just going to focus on that. And if I can have a big impact, helping people reduce suffering, I'm saying I'm exercising compassion. It does it for me. Pretty simple. This is a 17-year-old girl from East Timor, and her name is Anita, and she speaks English. She is Timorese, and you can see by looking at her leg that she has a major problem. This has been going on for 4 months now, and it's getting bigger and bigger. It's not going away. We did a biopsy, and this is osteosarcoma. Now, the proper treatment would be start some chemotherapy, specific chemotherapy, and after 2 rounds of chemotherapy, operate. If you can find the edges of all of the tumor, you could save the leg even, and you could have a 65% 5-year survival. That means she has a pretty good shot. We can't do any of that in East Timor. And then sadder yet, we have another one over here from the same part of the country, 19 years old, and her name is Olinda. Look at Olinda. Just starting her adult life. And she has the same kind of a tumor, but it's higher up. This is a whole mass here. It's rock hard. It's in her pelvis. It's as big as a volleyball. We've done a biopsy. It's chondroosteosarcoma. She also could probably have surgery done. She might have a pretty good chance. Once again, I appeal to people. If your heart tells you to do something, help these 2 kids. Okay?
What we've got at the moment is a facility working on minimal resources, treating an awful lot of people and doing a fantastic job. Our vision is to ensure that the quality of that medical care improves and improves and improves, And at the same time, there is so much more that needs to be done in a professional way. And so our plan is to find some land and to build a new facility. And in that facility, we want to enable some very skilled and experienced people to do things that can't be done in Timor at the moment, so that we can really make an impact on a lot of the serious illnesses here.
Our sewage system is not good. Even near maternity, you can smell some stuff, and people get blood washed down into the water that runs through like an open drainage area. And so we're going to try to shape all that up and cut down on smell, and probably even exposure to pathogenic bacteria, things like that. So those seem like they aren't very romantic things, but they all add up to give you a little bit better health care. So we're going to try and do a bunch of small things to get better. And if we're going to try to redo our emergency room, make it a lot nicer, so maybe we'd have a clean side and a dirty side so people can have minor surgery and it'll be a lot safer. Lots of things like that we can do, and it doesn't take a huge investment, but it takes some. And we can put it together, deliver a better service. If people donate resources, we promise to put it to work in the best way we can, and we have a lot of experience doing that. And we're not going to try to dump it all on one thing. We're going to be frugal with it. We're going to want to make it stretch out. We're going to try and make a lot of things happen with that.
What do you do for pain in East Timor, like painkillers?
We don't have everything we want. Although Timorese people are pretty stoic. But still, like these two girls with cancer, I know it's going to get nasty here pretty quick. And I don't have the right things. I wish I did, but I don't. So I have to just sort of hold off, because I'm saving my big guns for when I know there's nothing else. So you have to kind of play that kind of a game.
How much longer do those two girls have?
The one, I'd say she only has a couple weeks.